Psychologists. What's one thing a patient told you that caught you off guard? Or vice versa, patient's perspective. Story 1. My therapist once abruptly ended our session after telling me I needed to go to the ER. I'd been in a car accident the day before and had an undiagnosed concussion that was pretty bad. I was so out of it, I didn't even realise I was out of it. He later told me I was talking about inappropriate topics. I was so embarrassed, I didn't ask what I specifically talked about. I didn't want to know at that point. And wasn't making much sense. I'm just glad he recognised I was off that day and helped me get to the hospital. Man, concussions are hell. I've had a few. I've got one sister-in-law who hasn't spoke to me since I was chatting with her via Skype chat while recouping in the hospital. I don't even remember what I said. Honestly, gang, I couldn't think of anything worse than having concussion. I mean, everyone can probably say that. But being not in control of my body or what I'm saying terrifies me. Like, genuinely, guys, if I was saying things to someone and had no recollection, that would seriously terrify me. Like, beer fear is worse enough. Do you know what I mean? Waking up with a hangover, thinking, what did I say last night? But, I could not. Like, just the thought of it. I'm sorry if anyone has to go through that. Like, sounds awful. Story 2. Told mine I'd seen him grabbing a drink at the same place I used to go get drunk before COVID. He stared at me like I'd discovered something NASA was hiding. We had a laugh and he confessed it. Context. I had huge drinking problems, and he told me he didn't like to drink at all. Story 3. I paid and sat through an entire session of therapy during which my therapist ranted as to how great of a career he could have had as a stand-up comedian, and how much he regrets his current profession. I kinda agreed with him near the end. Story 4. During my first and only session with a particularly memorable child psychologist, he referred to me as a miserable witch. It was true, but he didn't have to call me out like that. Story 5. I'm a clinical psychologist working on the back end of my postdoc. I work predominantly with acute adolescent presentations such as chronic self-injury or sexual trauma. I'm so used to the young people I help hating themselves. It hurts a lot inside, but I firmly believe in catharsis through positive regard and validation. So as we do our therapy, I often sprinkle in comments here and there about some of the things about them I admire, respect, or appreciate. Things like their perseverance, their kindness, or their passion for an interest of theirs. I'm always so caught off guard when they agree with me or say something nice about themselves that it's really the only time I find myself slightly tearful in session. I'm always so damn proud of them and it hurts to hear the depths of their self-hatred. Those little moments of growth make me feel like it's the first warm day after... Oh, guys, you sound like the best psychologist ever. Doesn't she sound so sweet? I want an excuse to come and see you now. To be honest, let's not lie, I probably don't need use. You guys can all tell I've definitely got a screw loose. But yeah, can you, if you're listening, psychologist, what's your number? What's your name? Let me find you. I need you to help me and get my life in order, hun. Because let me tell you, you ain't seen nothing yet. Story 6. When I was in high school, I was hospitalized for being suicidal. My doctor there told me some really brilliant advice that totally cleared things up for me. Basically just fixing me on the spot. You just have to be a normal boy. Lol. Story 7. I'm really messed up. Been hospitalized a lot. I go through moments of such intense delusions that I'm no longer myself. I was admitted once after trying to get my veins out of my arm thinking they were wires. The doctor that was assigned to me wasn't really expecting me to be so paranoid. While in the observation room, he was trying to talk to me and I blurted, "What's it like being a robot, Mr. Robot Man?" I said, "Man," kind of like, "Man." And he started laughing. He wasn't expecting it, and I wasn't either. I laughed with him. He was such a nice East Indian man, and hearing anyone with the same accent. Story 8. I had one tell me I needed to learn to bite the bullet, which turned out to be good advice, even if it was blunt. I wasn't there because I was suicidal or anything. I was there because my mum and I had a pretty volatile relationship. She had some emotional issues where she'd just lash out at me over things that didn't make sense. And if I needed to learn to stick it out until she got better, which she eventually did, and we have a much better relationship, it really paid off. Oh, well, I'm really happy for you, okay? I'm really, really happy for you. There's probably nothing better than therapy actually working. Do you know what I mean? Guys who are listening, and probably very few of you, I can't lie, have you ever had therapy for anything? And did it work? Because I don't want to get too personal. Like, I think maybe I'd say a bit too much to you guys. But I'm really trying to look into health anxiety therapy. It's something that I really struggle with. Recently, touch wood, it's been quite good, but yeah, you never know when it's going to come back, and I'm really thinking of trying therapy. So anyone who has tried it, please share your positive and negative experiences with me, just so I can kind of like get a feel for it. Yeah, sorry guys, I act as if I've known you all for about 80 years. Story 9. When I was in first or second grade, the school counsellor fell asleep when I was describing a bullying situation that I was in. I was so young I didn't know how to respond, so I just sat there in his office until he woke up. Story 10. I had a therapist tell me when I was a teenager that she didn't know what else to do to help me because it seemed like I already understood everything pretty well. This was after my overbearing and crazy helicopter mum dragged me in for being depressed. Then she switched to therapying my mum, and my mum quickly was in tears because she has the emotional strength of a child and wanted it to be about me when it was actually all about her. I knew exactly why I was depressed. I was stuck by myself in the middle of nowhere with her crazy bum. No personal space, no ability to get away, not being able to say no, her getting jealous of my friends when I spent time with them. It would make anyone depressed. She didn't even let me sit with the therapist by myself. Story 11. Patient here. In response to me telling my therapist that I was prescribed Wellbutrin for my depression and anxiety, my therapist stated that it was a medication that a lot of adults with ADD see a positive effect with. It threw me off for a second and I was like, that's cool. Why do you say that? Therapist. Because you have ADD. Me. What? I do? Therapist. Yes. You present very typical ADD for adults. Me. Therapist. I thought you knew already. Me. Nope, but that explains so much. I also got a second opinion just in case, and it turns out I absolutely am ADD. Thanks, Doc. Yeah, I'm actually quite familiar with ADD. My partner suffers with ADD. It looks and feels as if it would be a very difficult condition to deal with. His attention span is, honestly, he's got the attention span of a squirrel. He's like constantly can't really stay involved in a conversation because he's got so many things whirring round in his brain. But he's also like the most laid back person in the world. It's like a mix of different things. It's actually really interesting, to be fair. But yeah, he doesn't take anything for it. He used to when he was younger, but he doesn't anymore. But yeah, there's like natural supplements and things you can take for it. Guys, I am not a doctor, by the way. Like, I'm just sharing my day-to-day life experiences with you. I hope you don't mind. Story 12. Was talking to my old school counsellor about some mental health issues and told him that I like playing card games to take my mind off of it. The man literally opens his cabinet and pulls out a briefcase full of Yu-Gi-Oh cards. I'm a massive nerd and says, "So, wanna play?" Don't get me wrong, but this guy had a lumberjack beard, was fit and looked more like an athlete than a counsellor, so I was shocked. Got over my problems and played every Wednesday against him. Thanks for my first award, kind stranger. Story 13. My therapist and I would end every appointment with a discussion of the latest Game of Thrones while it was airing. A great way to end things. Even the pooey end of the show got plenty of light-hearted ribbing. It was great because it wasn't too personal, and after talking about sex abuse for an hour, I could leave without being such a sad sack. Dude, that's awesome. I want your therapist, even though I don't need one. Story 14. After 5 or 6 sessions, I was about to schedule my next appointment when my therapist said she wouldn't continue seeing me because she should spend her time on patients who have real problems. I didn't see another therapist again for like 15 years. Yeah, see, guys, this is another thing that is kind of scary. Because I know people can have bad experiences with therapists and then it puts them off for life. Like, even though they actually need therapy and they should be, getting some guidance with how to deal with their issues, they actually won't get the help they need because they've had bad experiences with therapists. And this is a scary kind of thought for me because I know I'm that kind of person. Like, if I have a bad experience with one, I will think they're all the same. This kind of sounds like a me problem. But yeah, do you know what I mean? Story 15. First time I saw a counsellor, he was looking over my paperwork and said he could tell from my handwriting that I was good in bed. I kid you not. I was so caught off guard. All I could say was, I think I am. So young and not assertive at all. Found out he got in trouble for an inappropriate relationship with a client. But it really screwed me up for a bit, him saying that, because I have problems setting boundaries with men. That counsellor is a predator. He took advantage of being in a position of power over a vulnerable person. I hope you found your ways to build healthy boundaries. Story 16. When my psychologist told me as a 16-year-old that I'll never recover and that I should prepare for a struggling life. What? Shut up. That is the worst thing I've ever heard. What kind of psychologist is that? Jeez. I could have told myself that, mate. Cheers. Story 17. My therapist has teared up in sessions with me. My therapist cried at the end of a session once. While crying, she said, "Gosh, in so much pain." The next session, she profusely apologised for being unprofessional. We moved on. Looking back, I really wish I had the words at the time to tell her how much that meant to me. She was the first person who really validated the pain I was in and made me feel like I was someone worth crying for. Story 18. I was hospitalised a bit ago for trying to kill myself. When you do that in certain places, they can put a mandatory hold on you. I was held for 8 days at a psychiatric unit. It was maybe the most helpful mental health assistance I've ever gotten. I had very insightful, intelligent doctors and counsellors. At the end on my last day, I was leaving, and a nurse walked out of the secure portion of the facility and into a hallway. In the hallway, all of my doctors and counsellors had lined up to say goodbye on either side of the hall. As I walked down, my most favourite counsellor started singing Oh Holy Night for some reason. I don't know why, but I really loved it. Those doctors and counsellors were so relatable and down to earth, and I felt so awful when I got there, and I was so much better when I left. You know, it must be such a difficult, draining, exhausting job being a doctor or a therapist, psychologist, however many names there are for them. But it must be so fulfilling. Like, you did that. Like, that person's walking out a better person, a happier person, an internally happy human because of you, because of your hard work. Like, what a rewarding, fulfilling job, wouldn't it? Like, wow. Story 19. My psychologist, this is when I was 9, went up to my mother in front of 10 people and told her I was fricked and there was nothing he could do. So she might as well kill me. He said this in front of me, my sister, my only friend, who then moved, my grandmother, my grandfather, and 6 strangers. I was and still am in therapy for watching my uncle die right in front of me. Heart attack. My suicidal depression, schizophrenia, and anxiety disorder. I think I am fricked, not gonna lie. I've noticed a trend of messed up therapists here. I'm sorry you had to hear that. I would bet it's not true. That man should not be employed. Story 20. At the beginning of the session, we introduced ourselves, and then I proceeded to talk about my increasingly difficult battle with depression. I got a little emotional, but after almost 3/4 of an hour, he asked me if I remembered his name. For the life of me, I couldn't, and it just totally baffled me as I almost pride myself in being polite and remembering things like that. Story 21. Med student here who's seen some patients in psychiatry. Things admitted to me by my patients. A bleach drinking addiction. Murder. Many details of many suicide attempts. Many conspiracies about the world. How we're about to be new. Plans to murder people, often high up government officials or once my classmate. Every time a complex patient opens up about their past, it was always childhood abuse, and no matter how many times I hear it, I am never ready. Story 22. I'd been suicidal every day for over a year. When I was 14-15, I started seeing my first therapist. After a few sessions, she told me I was too happy to be in therapy and kicked me out. And it messed me up a lot. I've been told almost the same thing. I suffer from severe social anxiety, but get me one-on-one, I compensate by being too eager and talkative. They always tell me I'm too upbeat for anxiety and depression. On the bright side, I did finally end up with a good one. Wow, anxiety is such a difficult thing to deal with, isn't it? It's such an internal beast, an internal demon. Like, there does need to be more help for people out there, like, for all of us. Do you know what I mean? It's so important. Like, I always see it as if you've got a broken elbow, you can get help instantly. It's the same as if you've got a broken brain. Do you know what I mean? Like, sometimes I do feel like my brain is broken and I need someone to help repair it along the way. But yeah, anxiety is such a difficult thing to deal with because I always find I never know if what my head's telling me is true or not. I'm not going to go into it, but yeah. Anyone else? Do you know what I mean? Story 23. My psychologist's jaw dropped to the floor when I explained why a good percentage of my body was always covered in scars or bandages. It was from a mix of self-harm and from other miscellaneous things having caused a lot of harm to me. He ended up writing it all down and it totaled to a 2-page list. The majority of it was things like broken ribs from having an aluminium canoe thrown at me when I was 4 and having been stabbed repeatedly with a Bowie knife. This caught him off guard because I apparently always seemed unnervingly calm to him and didn't outwardly show any signs of significant childhood and due to one of my hobbies being boxing. Story 24. The moment when the psych looks at you and is trying to figure out if you're lying or not. I'm like, please, we haven't even got to college yet. Let's wait for the really messed up poo to happen. Story 25. The session was very blunt and it was question after question. I was eventually asked about drugs and I hesitated and squeaked, no? The stiff and serious atmosphere cracked at that moment as we both began to giggle. The woman had a serious face up until that point. Story 26. One of the more interesting sessions I've had with my therapist was getting into a tangential argument about philosophy. I don't mean clinically relevant philosophical questions like, why should I keep on living? I mean, we started bickering over our interpretations of St. Augustine of Hippo or something. I can't remember who we actually started arguing off the top of my head, but it was pretty funny in retrospect. I quite like her and I'm still seeing her today. I honestly bet there is nothing better than getting on with your therapist. Like, imagine being actual friends with your therapist. That would be amazing. I'd be like, please give me your number so I can text you out of hours, babe. Like, please, come on. If I'm in a crisis, I need you. So give me your digits. Story 27. She said, "You don't have to forgive someone, especially when they were so cruel and are not sorry." Shocked the hell out of me as any therapist before that tried to get me to forgive, but I can't. I live with it, and I don't think forgiving them would bring me any kind of peace. There's a difference between forgiving and moving on. You can't deny what the person did or how it affected you, but you can change how you react in the future to the trigger. There's people I'll never forgive in my life that I refuse to see or even talk about, but that doesn't mean I haven't been able to move on with my life through therapy. Story 28. I feel a sick sense of camaraderie seeing how many child psychologists fricked up other Redditors. Jeez. I was 9 or 10. My father left us and my mother tried to commit suicide shortly after. In a session, I spoke about being sad my dad left us. Then I was asked, "What did it feel like to know your mum tried to leave you forever?" I'd never framed her suicide attempt that way. I thought she was sick and needed to get better. That session really traumatized me and set me up for years of abandonment issues. Some people should not be allowed around children. No, see, this is another terrifying thing. Like, you don't actually know if these people are, like, do they have they studied to be a therapist? Have they studied to be a doctor? Do you know what I mean? Like, are they qualified? That's what scares me. Like, are these people qualified to deal with such personal, traumatic issues? Do you know what I mean? That's one thing that does scare me. Sometimes I feel like I'm on a talk show. I really do. It's a shame no one's talking back to me, but I mean, the comments are good enough, so please keep up the comments, okay? I hope you guys actually do like me and I'm not just rambling because I feel like that sometimes. Story 29. I had a religious therapist once tell me I just needed more water to solve my depression. She concluded this by having me hold out my arms, and she tested the strength of each one by pushing down on it, and I had to resist against it. Like, really? Looking back, I should have told her it was BS, but I was so caught off guard, I was just like, well, okay, I'll have some more water. Story 30. My most recent therapist experience lasted for 2 sessions only, both times. Every time I discussed an issue I was having, my therapist would say, "Oh my god, me too!" Like, I'm here for you to help me. If you're just going to say that, I can have this conversation on my own. The last session, the therapist said, "If we met outside of this scenario, we'd be really good friends." That was it for me. Story 31. Already wrote about this in a different thread, but when the marriage counsellor told my then husband and I that we were too hard to work with and she couldn't see us anymore, she fired us from her practice. She didn't make us a referral to someone else either. Similar. When the marriage counsellor asked to speak with me alone, to warn me that my then husband had displayed so many worrying signs of narcissism and character disorder during the one session that she worried for me and my infant daughter. The counsellor agreed to see me a few more times but refused to see the husband. Story 32. There's nothing I can do for you. Your problems are untreatable. I was 11. The honesty is now appreciated, but at the time it was so traumatic that I repressed the memory of hearing that and acted so horribly that Toronto healthcare people have seen me as the enemy ever since then. Honestly, are these people okay? Like, seriously, guys, are these people okay? How can you say that to an 11-year-old? Like, this just makes me think they're genuinely trying to, like, toy with your emotions because they're a person of power. Like, imagine saying that to an 11-year-old. I mean, that would be, if you're dealing with someone younger, you'd be even more sensitive, wouldn't you? Like, hypersensitive to their emotions. But obviously, this person's a right douchebag and they need a smack from Ashley. And I will be there to smack you up, bro. Story 33. The only thing that caught me off guard was when my client, after 3 weeks of acting more aloof than anyone I've ever met, admitted that he was only in therapy to get his mum off his back for having a hard time getting to sleep, which she thought meant severe anxiety. I spent the time in between speaking to my supervisor on how to touch on possible severe trauma. I felt like an idiot, but he kept coming back, so I imagine I was useful in some way. Story 34. Went to a psychologist when I was probably 13. I had depression, anxiety, and an eating disorder, and they often manifested in bad panic attacks and anger. After seeing him a few times and telling him everything, he brought my parents into the room and proceeded to tell them that I was fine. I was just angry at my parents and paying attention. I tried protesting and explaining myself, but he refused to listen and tried arguing with me. Needless to say, I never went back there and my parents took me to a new psychologist. It definitely fricked me up a lot, and even thinking about it makes me angry. Story 35. I was taking my teenage daughter who was struggling with an eating disorder to a therapist who specialised in that. Okay? And even though she was old enough to drive herself, I always took her and waited in the waiting room, just to be supportive for her, you know? And to be honest, I didn't think the sessions were helping all that much, but I was at my wit's end trying to help my girl. I knew enough was enough though, when after missing a few sessions due to other commitments, my daughter showed up to her appointment and the therapist greeted her with, "Wow, you look like you've lost some weight," in an approving tone. What the hell? We never went back. Oh, what a douche. Cheese, if you're listening, I think you can agree with me with this one, right? What an absolute douche. You have to be so careful with things you say as a therapist, surely. Well, just in general life, you have to be careful. Especially nowadays, you gotta be super sensitive. But, yeah, what an absolute donut. I would not be returning, especially if the reason you're seeing this child is because she has an eating blood. You know what I mean? Like, come on, bro, buck your ideas up, man. Story 36. I was making some light-hearted comments after the appointment with my psychologist about how people in my little town don't believe in the coronavirus. And he said, well, I think China spread it on purpose, so I may be a little crazy too. He didn't say China was negligent and allowed it to spread, which I think most people don't think is too far-fetched. He said they did it on purpose, like engineered it and caused the spread purposefully. Story 37. I honestly believe that you can always recover no matter how bad your situation is. A psychologist of all people shouldn't be telling you that you're fricked. I don't want to doubt people's stories, but I've often seen vivid misrepresentations of what goes on in sessions. This doesn't mean people are lying, and it doesn't mean that bad therapists and counsellors aren't out there in considerable numbers, one's too high. But it's still a relationship that can be highly complex and interactions that can draw out a high degree of defensiveness, anger, or other problem coping styles. Again, the point of this is not to disparage anyone, but to encourage everyone to seek out help if they need it, and learn about what sort of therapy you're getting. Story 38. I just described how I tried to kill myself when I was 8. My therapist was crying and had to stop the session. Oh, see, that would be... For any human to have to hear that, though, it is emotional. Like, I know they're supposed to keep themselves professional together, but I couldn't keep together, like, hearing that from an 8-year-old. You have to be seriously brave, don't you? Like, I know they're trained to do so, but wow, they're also humans. Like, hearing stuff like that it's emotional. Oh. Sorry guys, I just got distracted there. It's now pouring down with rain. It was really sunny a minute ago. English weather, honestly. Don't come here if you're ever planning to. Story 39. I once took a client, boy age 8, to Community Park and went over the rules of the park. Obviously rules of no running identified, but then they added no pushing. Especially girls heads over and over until they're flat dead. We left the park to discuss a few things along the lake instead. Story 40. My therapist told me, it must be nice to just be able to come here and not have any actual problem. I'm just someone for you to talk to. Like, actually, sir, I have lots of problems. Story 41. I was the patient in this situation. She called my parents to have a small chat with them. Nothing harmless, really, just to get to know them because of my complaints. And both my parents were there anyway. Next time I saw her, she casually said, you have your father's humour. And I replied something along the lines of, thanks, it's the trauma. And she laughed. She laughed. She found it actually funny and didn't shame me. It's not really interesting, but I have anxiety and thought she'd shame me for coping mechanisms. Such a sweet lady. Story 42. My wife is an LPC. She works with severe mentally ill patients, most with dual diagnosis. These are people that will most likely never get better or be productive members of society. I feel like she's an awesome and strong therapist. Many professionals in the field have told me the same. Working with these types of people can have moments that would catch many people off guard, but she's a boss. She asked one of her patients why he didn't want to eat lunch with the other peers. It's how they refer to patients because it's more humanizing. She said this was one of the craziest patients she's ever had, and that he doesn't live in this reality 23.5 hours of the day. In a moment of clarity, he told her his reason for not wanting to eat with his peers. I don't know if you know this, but those people in there are crazy. She said it was the one time she's ever inappropriately laughed in her professional career. Story 43. Bummer. I was really hoping this question got a lot of attention. Yeah, unfortunately, it has to get a lot of upvotes for an actual psychologist to see it. Story 44. As a psychologist in a prison many times, you can read past comments. One that always sticks out was a patient I really liked who always talked about her ex-husband in favourable terms. One day, out of the blue, she told me that she burned him on the leg with an iron many times and then would send photos to his family. She thought they were being mean to her. I was so surprised. She then outlined a lot of deep, dark thoughts she never disclosed before. Whoa, Nelly! Imagine burning your partner with an iron and sending the pics to his family. Okay, now this is... that's a hard one to imagine, but I've got awful imagery in my head right now. Yeah, not nice. That sounds quite concerning, and I'm glad this woman's with a therapist. Okay? Story 45. I had a client who was schizophrenic. Tell me he had the cure for MS. He told me that if you fed a seahorse cornflakes, it would emit a serum that would cure it. I'm just saying that I bet no one's tried it, so I couldn't contest it, really. Story 46. From a patient's perspective, I'd explained to my psychologist how I felt really bad about not wanting to go out on another date with this guy. Felt really bad. Guilty. Everything. He looked at me and said, well, why don't you fricking marry him? I just sat open-eyed and then laughed and said, "Wow, you're right. I never thought about that again." So now, whenever I feel bad about something inconsequential or little, I think back to his words. My psychologist was amazing though, and I always valued his bluntness, as that was usually the best way to get through to me. So guys, anyone with experience in therapists, before you actually go to see your therapist or before you're given a specific therapist, do they do an examination on who you are as a person and how you react to certain things? Because surely that would match you up with the correct therapist. Do you see what I mean? Like, not necessarily just based on the problems you're facing or, the mental health issues you have or the kind of anxiety or depression that you're experiencing, but more so kind of the fact that, like, who you are as a person and your reactions and your personality. Like, is that included in the examination to find the perfect therapist? I want to know. Story 47. This kind of fits. Caught my therapist watching corn off the reflection of his glasses during a Skype session 2 months ago. I'm no longer seeing him. I wasn't sure it was corn, but when confronted, he fessed up to it being corn. Story 48. My doctor told me to get a boyfriend to help with my depression. That definitely caught me off guard. Are you joking? I mean, if you want depression, get a boyfriend. Do you know what I mean? Story 49. My mum got family counselling with me, her son, and her. And after she had her 10 minutes alone with a counsellor, she called me in for my 10 and she told me something I'll never forget. Yeah, just go and live with your dad. Story 50. I was 27 before it was brought to my attention that I have debilitating self-loathing and I don't like myself. Legit, I was totally blind to it. Story 51. Psychiatrist here. Was having a totally normal conversation with a 12-year-old patient until the topic of homicidal ideations turned up. She lowered her head to the ground, flipped her hair to cover her face, and started talking in a high-pitched baby voice about how she constantly wants to kill her parents and classmates and detailed how she would. It was unnerving. Borderline personality disorder can be intense. Story 52. I confessed to my therapist that I developed a crush on him and had sexual thoughts about him. He looked pretty caught off guard. He was super professional and we worked through it in a productive way. Well, I mean, what was the name of your therapist? Name and number, please. If he's good looking and he can handle a nice compliment, then I want your therapist. Gosh. Story 53. Sometimes I did some stuff to women, like with sex. I know they didn't want it. I can be aggressive. This would not have been terrible in session, but this was as a grad student and was said to me once we left the therapy room, in the hallway and in a hushed voice. I sincerely was so caught off guard that I didn't know how to respond in the moment. Story 54. Ah, yes, my therapist. I'm a former K9 unit police officer, and I had to see a therapist after my last day serving because of an incident where I got shot in the stomach and watched my assigned K9 brick get shot and killed. My therapist. No poo. When I told her about my dog, said maybe I should get a cat. No poo. Story 55. I think psychologists are not legally allowed to answer this question. No, they are. They can't reveal the identity of the patient, though. Thanks for watching. Like and subscribe for more videos coming daily.